Good afternoon. And today we have a pleasure of interviewing medical doctor, Dr. Nishi Bhopal. And she's a sleep psychologist. And actually, in addition to being sleep psychologist, she also have a program to help other medical practitioners to learn more about sleep. So today we're going to find out a lot of intricate secrets about the topic I'm so passionate about. Good afternoon, doctor.
Oh, thank you, Maria, for having me.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is for you because we're going to talk about different remedies for sleep, supplements, sleeping pills, therapy for racing thoughts. And if you're a medical practitioner who, just like us, passionate about topic of sleep, we can put puzzle of this dangerous condition or really frustrating condition together and find the solution for our patients. And I'm going to tell you my story of meeting Dr. Nishi. We met on Sleep 2024. But I heard about Dr. Nishi and Intrabalance before because we have a lot of friends in common. And Dr. Nishi graduated from medical school, actually in Ireland, and she has a full training here in the United States, and she's practicing in San Francisco, California, and she has a strong presence on a social media where she shares her valuable advice about sleep. My first question to you, how you become so passionate about sleep?
Oh, well, thank you so much. So, and I'm just going to do a quick correction. So I'm not a sleep psychologist, I'm a sleep psychiatrist, which is a little bit different. Yes. So there is a difference, and we can talk about that difference as well, because if people are seeking treatment, it does make a difference if they're seeing a psychologist or a psychiatrist, because it's a slightly different approach. So how I got interested in sleep is I was someone who always struggled with my own sleep before I even went to medical school. Not so much insomnia, more of feeling tired all the time, excessive daytime sleepiness. I couldn't get up for school on time. I had a delayed sleep clock, so I was one of those students where I was like, it was so painful for me to get up for early morning classes and those types of things. And then, I felt like I just couldn't get a handle on it. And then when I went to medical school and residency, sleep is not a priority when you're a student, right? Like the system is set up to make you sleep deprived. You're doing these long shifts. So it was really painful for me. And I was just like, oh my gosh, what do I do about this? And at the same time, I was working with patients during my training, my residency training, and they're struggling with sleep. And I'm seeing how their sleep issues were affecting their physical health, their mental health. And I wanted to learn more about how to support them. And around this time, one of my senior residents was actually going into a sleep medicine fellowship. And I didn't know that was a thing you could do. I was like, oh, sleep medicine, like that's a thing. And so she introduced me to sleep medicine as a field. And I started doing research with the sleep lab at Henry Ford Hospital in Detroit, where I did my residency. And I just loved it. I just found it so fascinating. And so that's how I ended up applying for a sleep medicine fellowship after my psych residency. And then I learned also about integrative medicine. And so now my approach is this sort of integrative, holistic approach to sleep.
So you basically were in the same shoes as a lot of your patients. And as I'm not a sleep psychiatrist, but a lot of patients come to me with a complaint either on a bad sleep, so they wake up multiple times, or they don't feel themselves during the day. They feel tired and everything, they become so difficult. And I want to say, study shows what 99% of the population suffer from insomnia at certain point of their life. So please tell me, as a sleep psychiatrist, what's your view on insomnia and why it's so prevalent and what to do about that?
Yeah, so with insomnia, most of us have experienced, what we might call acute insomnia at some point in our lives. So you might have a night here and there where you have trouble falling asleep or staying asleep. But some people develop what we call chronic insomnia, where they have trouble falling asleep or staying asleep at least 3 nights a week for 3 months or longer. So this is known as chronic insomnia. And we are seeing rates of insomnia increasing, and especially during the pandemic, right? Like, I think that's when people really started to pay attention to their sleep. At least I was seeing that with the patients in my practice, and I was getting lots of questions about it. Why is it so prevalent? I think there's lots of different reasons for that. I think one is we live in a stressed out society, right? Where people are anxious, they're depressed, they're having trouble sleeping. We are not prioritizing sleep as well, many of us, right? So that's a whole other separate issue. But, about a third of adults in the US are sleep deprived. The CDC has declared insufficient sleep a public health crisis. The WHO has deemed this as well. So it really is, it's a global crisis. It could also be, this is the integrative approach coming in, maybe even related to some of our lifestyle, some of the food that we're eating. We're just not getting the right nutrition. When you were on my YouTube channel, we were talking about the airway. Airways are not developing properly now. People are having sleep disordered breathing. That's disrupting their sleep, and that can look like insomnia. So there's all of these different puzzle pieces that, we need to look at. And so, when I'm as a psychiatrist, as a sleep physician, if I'm working with the patient in front of me, I'm thinking about all of these things and what makes that person unique, because that person's sleep issues who's sitting in front of me, it may look similar to the next patient. Like they both might be having trouble falling asleep, but the reasons behind that could be completely different for different people.
What can be the reasons?
Yeah. So, one is it could be insomnia, right? So it could be that maybe they've developed some anxiety about sleep. Maybe they've even heard all of these different podcasts about sleep, and they're going, oh my God, if I don't get good sleep, I'm going to develop all these horrible health issues, right? So I think sometimes, even as sleep specialists, when we're talking about these things, we have to be mindful, because then people can take that away and go like, oh my God, I'm not sleeping well, I'm going to get dementia or whatever, right? So there could be some anxiety around that. So that's one reason. And so we can work on that. Other things could be circadian rhythm disorders. So maybe this person has a circadian rhythm misalignment, like I had, right? So I figured out later, oh, that was what was going on with me. I had a delayed body clock. So maybe they're not falling asleep until 2 a.m., but if left alone, they could sleep until noon, right? But it can look like insomnia. So there could be something like that. It could also be a sleep disorder. There's over 80 different sleep disorders described in the ICSD-3, which is the International Classification of Sleep Disorders. So it could be something like sleep disordered breathing, sleep apnea that you and I have talked about. It could be restless leg syndrome that's making it hard for somebody to fall asleep. In some cases, I'll see blood sugar fluctuations. If the person, there's too much of a gap before they go to bed and their blood sugar is fluctuating, and that's causing sleep issues. So there's a whole host of things that could be contributing. Mental health issues, of course, too. So if someone has depression, anxiety, PTSD, so there's lots of different aspects. There's kind of like 4 main categories, though, we can look at. So one is environmental. So it's just the setup of where they're sleeping, right? That can also have an impact. There was a story that I can share of a patient of mine that I saw. She had been struggling with insomnia for many years, and she had seen different doctors. She was seeing psychiatrists. They said, oh, you're depressed. So she was getting all these treatments. They eventually put her on Ambien. And she came to me because she knows I do this holistic approach. And she said, can you help me figure this out? I don't want to take this medication. So the first thing I ask people is, tell me where you sleep. And I'm in San Francisco. So she sleeps in this like tiny little apartment. We have small spaces here, tiny little studio apartment. And she was sleeping in the closet where there was no ventilation, no windows. It was stuffy. She couldn't breathe. It was dusty. And I said, of course you can't sleep if that's where you're sleeping. So the first thing I had her do was move her bed out of that closet near the window. She put up a nice screen, had a beautiful sleeping environment. She was able to open the windows, and now she can breathe. And can you imagine her sleep improved, like literally overnight?
Absolutely. Yeah. You were like a good Sherlock Holmes detective.
Yeah.
You will find out, yes.
And now on Zoom with seeing patients on telehealth, we can actually ask them, can you show me your bedroom? Let me see where you sleep. So that's one factor. Yes, absolutely. So there's all of these different pieces that we like to look at.
And now we're talking about sleeping pills. I have trouble sleeping myself. That's why I'm in sleep. And I always have that dilemma about sleeping pills. Should I take a sleeping pills or maybe not take a sleeping pills? What's the right way to deal with the sleeping pill, concept?
Sleeping pills were not designed for long-term use. They can be helpful when used short-term in certain situations, but if someone is needing a sleeping pill long-term, then I really like to look to see what else is going on so that we can help them reduce their reliance on sleeping pills, taper off safely, and find other tools and other factors that might be contributing to their sleep issues. So it's very possible to get good sleep without having to rely on sleeping pills long-term.
So basically, like your answer, sleeping pills, emergency treatment, like a bandage for a wound, not so bad. People should take their anxiety away if they cannot sleep. So maybe a little bit, just in case, take an edge off. But if it's a long-term, good specialist like you, sleep psychiatrist, would be the good professional to discuss it with, that topic. So my other question, if sleeping pill is not a great solution, tell us about supplements. What somebody who doesn't have, you just mentioned a lot of, sleep apnea, all these conditions, if we rule them out, what can be done with the supplements to ensure good sleep, restorative sleep?
Yeah, so just like with sleeping pills, supplements can be useful in certain situations. And I like to think of supplements in three categories. One is, are we repleting a deficiency? So are we repleting a vitamin D deficiency? Iron deficiency is associated with restless leg and restless sleep. So are we using it for repletion? Are we using it for prevention? So for example, if someone is pregnant, we might use folic acid or something like that, right? But it's not specifically for sleep, but a prevention strategy. And then are we using it as a therapeutic? So are we using it to help reduce anxiety and reduce stress and help calm them? And that might help with sleep onset. So those are the three big categories. Now, I don't like to use supplements in isolation. Anytime I'm using a supplement, it's going to be with behavioral strategies and also looking at the underlying causes. But there are certain supplements that can be helpful for sleep when used strategically. It's not for everybody, but we have to use it in the right way with a personalized approach. So I can share those different supplements. Yeah. Okay. So the supplements could be melatonin. I know a lot of people use melatonin.
Yes. A lot of questions about melatonin. If you can give us a little bit broader, more information on melatonin. A lot of people rely on melatonin.
Yeah, absolutely. So a few things about melatonin. One is it's a hormone and it's a body clock regulator. So it's one of the chronobiotics that regulates our sleep-wake cycle, our circadian rhythm. So I don't think of it as a sleep aid. I think of it more as a body clock regulator. Now, melatonin is over the counter here in the US. You can go to Target, Safeway, you can just buy it. In many countries, it's a pharmaceutical. It's by prescription only. So I want people to remember that this is a hormone. And in many countries, you have to have a doctor's visit to monitor, right? So it's not something people should just be taking off the shelf and self-treating. However, melatonin does have certain purposes, and it can be really helpful to reset the circadian rhythm, to provide a little bit of sleep support for people who are taking melatonin-depleting drugs, things like fluoxetine or Prozac, beta blockers. Those drugs can deplete your secretion of melatonin, so sometimes we might be using it for repletion in those cases. Melatonin is fascinating, though, because there's also research ongoing into its anti-inflammatory properties. It's an antioxidant. So it's being used for long COVID. It's being studied in certain types of cancers, in inflammatory conditions, and so on. The dosing strategies, though, for that is different. For sleep, we're usually using doses of 0.3 to 3 milligrams. The timing is also really important as well, because it depends on the person's circadian rhythm. So you can see melatonin is a huge topic, right? I have a whole entire mini course on melatonin inside of my program for practitioners so they can learn how to use it properly. But the one takeaway I want people to hear from this for your listeners is quality really matters. You want to look for, if you are taking melatonin, whether it's recommended to you by a practitioner, you want to make sure it's a third-party tested supplement. There was a study in the Journal of Clinical Sleep Medicine and another one in JAMA, both of them looking at over-the-counter melatonin supplements, and the quality concerns were really horrible. Some of the supplements didn't even contain melatonin, or they had like hundreds of times more than what it said on the label. So you have to be really, really careful with these over-the-counter supplements.
Got it. What other supplements you have in mind? And I also have another great question about racing thoughts.
Okay, other supplements that can be helpful. A lot of people are hearing about magnesium on social media. I'm sure many of your listeners have seen sleep protocols by influencers that have magnesium in them. I have a pretty low threshold for recommending magnesium to our patients. Many of us are deficient in magnesium. It's the second most abundant mineral in the human body. It's involved in hundreds of different enzymatic reactions. It's involved in GABA and melatonin synthesis. It's calming for the nervous system. However, what people should know is that the research on melatonin for sleep is not as robust as you might think it is based on what you're seeing on social media. There's some mixed studies and some studies in older adults showing it could be helpful. However, that doesn't mean I don't think that it's helpful for people, but just don't have the expectation you're going to take melatonin now, all of a sudden your sleep is going to be amazing. It doesn't way, but it does work in the background to give you that physiological support. And because so many of us are not getting enough magnesium, I do like using it, especially for people who have anxiety, muscle tension, migraines, and along with, sleep issues.
Yeah, and now I would like to ask you about racing thoughts. A lot of people come to me and they say, I wake up, 3 o'clock, I guess after a cycle, and then I have those racing thoughts and I cannot calm them down and I cannot go back into my wave of sleeping. So as a sleep psychiatrist, what's your thought on racing thoughts?
One of the reasons we get racing thoughts at night is because we're so busy during the day, we don't have time to think about stuff, right? We're caught up in our day-to-day activities. Now, finally, it's quiet at nighttime, nobody's bothering you, and all those racing thoughts come up to the surface. So one of the tips that I give to all of my patients is to do what we call scheduled worry time. This is a technique from cognitive behavioral therapy. You can also call it a brain dump. And how this is done is you schedule yourself, 5, 10, 15 minutes during the day, whatever you have, set aside that time, not right before bed, but maybe after work is a nice time to do it. And you just grab a piece of paper or a Google Doc and you just write out all the things that tend to swirl around your mind at night. I like to do it with pen and paper because there is something about transmitting those thoughts physically. And so it really does help. So it's a kind of a journaling practice. And you can literally just sit down, write out all the thoughts that tend to swirl in your mind, or make categories on your piece of paper. So you might have categories for work, family, medical, financial, home stuff. And then you just write in each of those categories, because oftentimes the racing thoughts could be about things that we have to do. I have to remember to follow up on that email. Oh, I have to make that doctor's appointment. So you can get that all out, or it might be more abstract things. And so this will give you the opportunity to sit down and make sense of some of those thoughts, or just at least release some of those thoughts.
So great advice. Great advice. Now I want to ask you about the training program you have for medical professionals. And I know some medical professionals audience of my channel. So if somebody wants to get more knowledge about sleep, Dr. Nishi has a beautiful program online that you can learn. Tell us a little bit more, and I hope when we broadcast, you put information in the comments on the YouTube and Facebook, what practitioners can help you and learn about the program. But give us the overview of your program.
Thank you. Yes, so my program is called the Clinical Sleep Kit, or CSK, and it's for professionals. It's for healthcare practitioners, for physicians. We have dentists in the program as well. And it's really for all of us to enhance our our skill set when it comes to sleep medicine, because most doctors get only about 2 hours average sleep education in medical school, but every single patient has to sleep. So in this program, there's 3 pillars. We've got self-guided training. So you'll learn how to use melatonin, basic interpretation of sleep studies. You'll learn how to implement principles of CBTI, or cognitive behavioral therapy for insomnia. All of these trainings are there, and you go at your own pace. The second pillar is live calls with experts. We have sleep experts who come in, and we have live Q&As with them. You can learn from them, ask questions. We also have a live call every month on case consultations, so you can bring your cases and we can discuss them and talk about how to better support your patients. And the third pillar is the private community, where you can connect with others in the program. You can ask questions, share resources. So it's just a really wonderful resource for any healthcare practitioner who's working with patients who have sleep issues.
Thank you very much. We really appreciate your vast knowledge, and I hope through the contact information, my audience can get in touch with you and learn a lot about sleep and supplements and melatonin and all of that. And your videos are great. They can find them on the YouTube channel, and very interesting topic, and even in a blog on the website. I also enjoy that. So thank you very much.
Thank you for having me.